everyone, Dr. Christine Kaczmar coming at you here. Happy Monday. It is July 24th, 2017, and it's almost 4:45, I think, on the Eastern Standard Time Zone. So if you're watching this after that, thanks for watching the replay. I appreciate you. Who am I? Well, as I said, I'm Dr. Christine Kaczmar, and I'm on a mission. And my mission is to save 5 million lives from the broken medical model. The medical model is extremely broken. And when I talk about the medical model, by the way, I'm not talking about crisis care, emergency care, gunshot wounds, burn victims. I'm not talking about that. Okay, this is where medicine really excels and exceeds expectation, right? What I'm talking about when I say broken medical model are things like Crohn's, colitis, common colds and flus, diarrhea, constipation, nausea, headaches, heartburn, all of those types of things. These are the areas with which I describe the medical model to be broken. The medical model is broken because they treat everybody the same. It's a one-size-fits-all approach. The medical model is broken because they rely on prescription medications, which will never restore function. Understand that. Prescription medications will never, ever restore function. Just today in practice, I have a patient who had some tissue removed from her breast, and the typical protocol with any of that kind of thing is the radiation and then 5 years of tamoxifen. This is a high alert drug, damages the blood, can create leukemia, and yet they want to put people on this for 5 years. Another example of the medical model being broken, okay? So what I want to do is talk to you today about energy and food explained. And what I mean by that is when we think about food, we don't really connect the dots to what's going on with food and gut to stiff, achy joints, headache, heartburn, nausea, constipation, Crohn's, and so forth. But I'm here to tell you they're very much connected. One of the big problems people have is, and you've heard me say this a lot, is people think you are what you eat, right? People say that all the time, you are what you eat, and that's just false. Better said is you are what you digest, okay? You are what you digest. That's the key here. You are what you digest. Just because you eat something healthy for you, in fact, most of my patients who come here and sit in my consult with me, they're eating well. Their diets are great. They're eating plenty of green, leafy vegetables. They're really plant-based, but yet they are having problems with irregular periods or nausea or diarrhea or Crohn's and this kind of thing. So again, it's not that you are what you eat. Better said is you are what you digest. And so food is the real medicine. Food is the real medicine. Prescription medications is not going to restore function, but food, fats, carbs, proteins, vitamins, minerals, and enzymes, that's what's going to help restore function. And why that is because that's what the body wants. So I'm going to do a little whiteboard action here. Hold your questions to the end. I'll come back and answer your questions at the end. And then also want you guys, if you're interested in this video, check out my podcast. And you can find my podcast on iTunes. It's called Smart Digestion Radio. If you want to learn more about my products, I have 3 products in my digestive line. I have a digestive enzyme, I have a probiotic, and I have a healing enzyme. And they all are in the Smart line, meaning Smart Carbs, Smart Lymph, and Smart Probiotic, and you can get there by going to omegadigestion.com. Okay? So what I'm going to do now, and by the way, I think I'm having a problem seeing your comments or anything anyhow, so I apologize if it looks like I'm ignoring you. I'm not seeing anything show up, so it might be one of those broadcasts. So hopefully this will rectify by the time I finish. So at any rate, whether you're watching live, which I can't see you, or the replay, I appreciate you being here, and I'll come back after and look at the comments, okay? So let's turn this around and do some whiteboard action. Okay, so we got energy and food explained. And what I have here, CPF, you probably know what these are, but let's kind of get to this first. So what is food exactly? Because this is the real medicine. Food is the real deal, okay? That's the real deal. RX, not the real deal. This will never restore function, ever. Then this causes more sickness and disease, okay? You can't keep treating symptoms and expect good results. That's insanity. Food is what really the answer is. And so when we look at food, we have fats, carbs, proteins. And again, guys, sorry, I cannot see who's there. It's just one of those broadcasts. It's not showing me anything. So foods are 6 things: fats, carbs, proteins, vitamins, minerals, and enzymes. This is what foods are, these 6 things. Okay? Now, let's go back to my board. When it comes to energy, your body is going to utilize food in this exact sequence. So the C stands for carbohydrates. Okay? These are things like your fruits. These are things like your sweets. okay? These are things like beans, some dairy. Those are the primary sources of carbohydrates. The P stands for proteins. I'm going to go over all this more later. So this is going to be things like eggs, nuts, fish, meats, some dairy, okay? And then finally we have fats, okay? And so this is going to also be things like eggs, nuts, oils, okay, some dairy, and so on. Okay, so some of these overlap, all right? Now, when your body needs energy, let me turn this around. What's important to know is this, okay? And that is, there are three main reasons why we need energy as human beings. We need it for our brain, we need it for our viscera or our organs, and we need energy to oppose gravity. These are the main three reasons why we need energy, okay? For our brain, takes up more energy, uses more energy than anything else in our body. For our organs, and then to oppose gravity. That's why we need energy. When it comes to the order with which the body uses energy, it's the brain first, gets the most, your heart number 2, and then your liver, okay? As we take food and we digest it in a healthy way, we should be maximizing the amount of energy from our carbohydrates. The main reason for carbohydrates is energy, period, okay? So for carbs, their job, supply energy. Period. Okay? That's their main job, to supply energy, period. Now, when we're not effectively digesting carbs, some of the things that you might notice when you're not breaking them down is you might be really dry. You might be dehydrated. You might have the inability to concentrate. You may have a lot of muscle cramping. You might have a lot of low energy, fatigue. Okay? These are just some of the things when you're carb deficient, when you're not utilizing carbs from your diet properly. In other words, when you're not digesting carbs well and or eating enough carbs. When you're not digesting them well or eating enough. Most often is we're eating too many carbs, but we're just not digesting them. So when I say deficient, it means two possibilities. Not digesting and or not eating enough, okay? Don't just think deficient because you're not eating enough. That's not the main reason. So that's going to lead to dry, itchy skin, dry eyes, dehydrated, can't concentrate, muscle cramps, low energy, fatigue, okay? This is the number one reason, this is the number one reason we get our energy through carbohydrates. But when the body can't effectively use the energy from your carbs because you're not digesting it or you're not eating enough, now your body is going to start tapping into your proteins for use, something called gluconeogenesis, okay? So your body's going to start breaking down your proteins for sugars. That's not how the body wants it to go. And as I said, carbs, their main role is to supply energy, while proteins, they do a lot of other things, okay? So their number one task is not to supply energy at all. It is to give us, from the food we're eating with protein, to give us insulin, thyroxine, hemoglobin. This all comes from your proteins, guys. Your neurotransmitters. Okay? Epinephrine. These are the things that we get from protein. So you can imagine then, if you're not properly digesting your carbs, you're not going to get enough energy. Now the body's got to start utilizing proteins for use. It'd rather not do that. And if it has to use proteins for use for energy, what do you think is going to happen with the creation of these very important chemicals here? They're going to start to be disrupted. So we now have entered into this cycle, this cascade of doom, if you will, because we should not be using proteins for energy. We should be using carbohydrates for energy, not proteins. Now, the problem with medicine as well is they're not looking at protein deficiency the way that they should. In fact, it's very rare that they will ever find it unless someone is near death, because they're looking at blood work all the time. And blood reigns supreme, as I say. So you're not going to see a lot of protein deficiencies in a hospital or in the medical model because they're testing blood. Whereas my test, I'm looking at a very specific 24-hour urine collection as well as a specific exam for me to determine this kind of thing. So I can see that all day long in my practice. Now, if you're having some signs of protein deficiency, meaning symptom-wise, so we talked about symptoms attached to carbs, being, dry, dehydrated, and so on. When you can't digest proteins, you might notice that you're wet, okay, an increase in secretions. So you have watery eyes, watery nose, okay? You're going to have cold hands and feet. And again, I can't see your comments. I'm so sorry. I know you're there. I feel you. Menstrual cramps. Bleeding gums. I know my writing is atrocious, but when I really try, I write nice. These are just some of the symptoms that one might have when they're protein deficient. Again, meaning not digesting protein well primarily, and also not eating enough. Okay, protein deficient. And finally, how we use energy. We would rather not, but now we're starting to dip into fats. And this is not what the body prefers. And I'm not talking about a ketogenic diet, by the way. Okay, that's a whole different animal. I'm talking about just somebody eating normally as they think is a normal way to eat. We should be getting our energy from our sugars or our carbs first, then proteins if necessary, and then very last, the body's going to tap into the fats for energy. And this is not good. Okay, because your fats have other roles that are more important than giving us energy. And these are going to be things like prostaglandins. Fats in our diet supply us with prostaglandins, which have a lot of inflammation effect. It has everything to do with getting pregnant, keeping the baby, holding the baby to term. Prostaglandins has a lot to do with that. Fatty acids are derived from fats. Phospholipids. These are your cell membranes. Okay. We've got our cholesterols. We've got our sterols. We've got our sex hormones. These are all derived from fats in your diet. Okay, so that's their primary role, is to give you these things. Prostaglandins, fatty acids like omega-3s, omega-6s, and so on. Your phospholipids, which are your cell membranes. Cholesterol, sterol, sex hormones. These are supposed to be the primary thing that fats give us from our diets, not energy. And then back to proteins, I talked about how they supply us with insulin, thyroxine, blah, 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 right? So let me turn this around. So imagine now if you cannot properly digest these three macronutrients, your fats, your carbs, or proteins. Imagine now that you're not properly digesting these nutrients. Now you're going to have energy deficiencies. Energy is everything, okay? We talked about the brain, the viscera, keeping us upright against gravity, right? So if you're not supplying yourself properly with the food you're eating, that's a problem. And also, more commonly, is if you're not properly digesting what it is you are eating, this is going to create energy deficiencies. This is going to create distortions in human health. And so when you have stiff, achy joints, when you have heartburn, when you have diarrhea, when you have constipation, I don't want you just thinking about those symptoms. I want you first to be thinking, you know what? I have energy deficiency. Somewhere my body is not utilizing the fats, the carbs, the proteins the right way. And let me just tell you this as well. Vitamins and minerals do nothing to supply you with energy. Let me say that again. Vitamins and minerals do nothing to supply you with energy. Fats, carbs, and proteins do. Specifically carbs. Okay? Vitamins and minerals are effective in the presence of enzymes to do what they need to do. So you might be wondering, okay, you didn't talk to me about the symptoms of fat. You talked to me about the protein and the carb. Let me get back and I'll show you that, and then I'll get into some, hopefully the questions will show up, but I'm not seeing anything. So when it comes to fats, some symptoms that you might experience when you have a fat deficiency, again, these are the symptoms associated with deficiencies. And these are going to be things like also dry skin, tremors, pregnancy, okay, women have an issue with pregnancy, keeping the baby to term. Also inability to concentrate. Okay, this means concentrate. And those are the main ones for fats. Okay? So you may be wondering, okay, great, this is nice. You're teaching me some things here. I have some of these symptoms. I think that by what you're saying, I might be in the protein deficiency area, right? Well, what you do is you go to a doctor who knows how to test for this kind of thing, and that's what I do. If you're local, if you're in the Shelby Township area, that's where my practice is. Or you could be somebody like Erin who flew all the way from Australia to come see me. Completely extreme situation, right? But it was worth it to her. If you were local, how I would identify for these energy deficiencies is very specific. You would come in fasting for 8 hours, so while you're sleeping. In the morning, you would wake up, you just have a little bit of water, like so. See what I did there? And you would lay on my table, and with my hands, I'm going to feel for involuntary muscle contractions. Why is that so important? The answer is when the viscera, aka organs, have energy deficiency, that is going to lead to involuntary muscle contractions. I'll say that again. When the organs, viscera, have not received what they want, when they're energy deficient, when you are not extracting from your food, your fat, your carb, your protein, the energy that you need, now the viscera, the organs, be punished, if you will, and they're going to show and represent with involuntary muscle contractions. And so as you're laying on my table, again, this is if you're local, with my hands right over your clothes, I'm feeling over 20 different digestive stress points attached to the viscera or the organs. That's part one. I'm making my notes. Then I give you a meal to consume, which is a liquid form. It's a tea, if you will. It's just a little bit of water with some food in it, which is equal amounts of food, fat, carb, protein.